this computer. Okay, now gentlemen, today we have to discuss the unit 2 of this ProQual level 6 NVQ diploma in occupational health and safety practice. So unit number is F/616/9531. And the name of the unit is develop and implement the health and safety policy. All of you know that health and safety policy is the basically the responsibility of the top management, and at the end of the day, the employer is responsible for this. Before going forward, all of you who have completed this level 3 qualification, he should know that this clause is on the employer through C155 RT. Please mute yourself kindly. Okay, so the unit this is like a C155. There is a convention of ILO and article number R164, and the article number is 14, which actually bound the employer to develop or establish a health and safety policy, and not just establishing an health and safety policy. Also, he has a responsibility to communicate that health and safety policy in the workplace in the medium which is acceptable to all the workers or all the employees of the organization. So you should remember that it is a legal binding or legal obligation. Now moving forward, in this unit, as all of you know, that we have learning outcomes, and with respect to that, those learning outcomes, we have to met the assessment criteria. So in this unit, we have 4 learning outcome and 18 assessment criteria. So in these criteria, like we have in first one, we have 5 assessment criteria. In the second one, again, we are having the criteria about 6 criteria, then 2 criteria in the third one, and then we have 4 criteria in the 5 criteria in the 4th learning outcome, and in the 5th one we have 1 criteria. So we have to complete this qualification when we will have completed all these learning outcome. So now moving forward, I am going to start discussing each criteria with respect to this. So in learning outcome 1, what it is asking for? It is asking for be able to define the statutory and workplace health and safety requirements for the organization. So what we have to see that what are the requirements of workplace, or what are the legal requirements we have in our organization. So we have to define that, or we are able to define that. What is the meaning of here? That why we have to define that? Actually, this learning outcome is concerned about, or you can say it is asking about the requirements implemented on the organization, or you can say on the workplace, with respect to workplace itself and the legal requirement. So we have 1.1 assessment criteria analyze the structure of the organization relative to health and safety. So here what you have to do, you have to describe, or you can say that you have to explain that what is the structure of your organization with respect to health and safety. It means that on each managerial level or on each organizational level, what type of roles and responsibilities are there. In this regard, you have to let you have to write, or you can say you have to explain that what are the roles and responsibilities of the persons working in different levels of organizational structure. So in regard to that, what you have to produce, like first of all, for this, the evidence you can use is health and safety policy, because all of you knew very well that the organization section is a part of health and safety policy. So keeping in mind that the organizational section is the second part of health and safety policy, so if you can produce an health and safety policy describing the roles and responsibilities of people which are present in the organization, so it will be it can be considered as an evidence. Other than this, what you can produce are different roles and responsibilities, but these roles and responsibilities should be defined by a competent person. Like if someone, you can say that there is not clearly defined roles and responsibilities in your health and safety policy, then you will move to the workers, or you can say employees of the organizations job agreement, because in each job agreement you can see that there are clear designated roles and responsibilities which can confirm us that on different levels how organization is managing the responsibilities of all the workers working there. So in this regard, you can produce health and safety policy or roles and responsibilities document. So after that, we have 1.2, advocate the, yeah, Mahmoud.
Sir Asad, if like our company, they have a construction management plan,
Yeah.
in that one, they are defining the rules and responsibilities. And after that, we have another procedure that whoever who is coming as a construction manager or planning engineer or whoever, he is coming, he is signing on his own paper, own roles and responsibilities. So this evidence is okay for you?
No. What is the reason, Mahmoud, that when you are going to discussing the construction plan, in construction plan, you should have different roles and responsibilities regarding other activities too. So, and contractor and construction plan or other plans are actually the secondary documents. So health and safety policy are health and safety documents which are mainly focusing on health and safety responsibilities will be considered the right mapped document for this assessment criteria. Mahmoud, is it fine?
Actually, what I mean, even in the CMB,
Yeah.
in the roles and responsibilities, they are defining the safety rules and responsibilities.
But that is not from the top management actually. Like you can see that it will be like something specific. But here we are discussing the overall environment of the organization. Here we can't go as a specific part of the organization, like construction plan, like some plan, something else. Because here it is saying that health and safety policy. So health and safety policy for health and safety management system. So we have to consider from top to bottom,
So the
because
health and
yes, yes,
safety plan, which is be signed from the top management.
yeah.
So this is
But
a
but
commitment.
but
This is a commitment from the management. It's defining inside the roles and responsibilities for each one.
okay, that is defining, but what happened, that that is not giving any clear rules for all the organization, because in that plan maybe you will consider the workplace health and safety requirements. In for considering the legal requirements, then you have to go for the main health and safety policy, because what happened, the construction plan can be developed by the team just considering the workplace health and safety requirements and responsibilities. They are not discussing the statutory requirements, not discussing the legal requirements. For considering the legal requirements, you have to be mapped your this assessment criteria towards your main occupational health and safety policy, which is showing the general structure of the organization and assigning the roles and responsibilities only with respect to health and safety matters.
Okay.
Okay. Yeah, teacher.
Yeah, so does this mean we cannot use a job description?
Sorry?
Does it mean we cannot use job description because some job description?
Yeah, with job description, but teacher, it should be job descriptions. It is clearly a reference to the health and safety matters.
Okay.
Okay, because it is discussing the organization structure of the organization relative to health and safety. So we will not consider other things here. We will be just focused on health and safety roles and responsibilities. Whatever the role, whatever the job you are doing in the organization, but you have to perform, or you should have an extra responsibilities of health and safety. So it is just discussing about the structure of organization relative to health and safety only. It is not discussing the other portions or departments. Yes.
Because in our job description,
Yeah.
you have other specifics, but the health and safety part is also in the same job description. So I'm not sure if we have to remove and leave only the health and safety part and then submit as evidence, or we can submit all, including everything. That's what I want to know.
Yeah.
Because health and safety
go on.
also is in that job description.
But we should consider simple, just keeping it simple, teacher, that whatever the roles you have in the organization with respect to your activity, okay, but here we are discussing the roles only related to occupational health and safety. Okay, yes,
no,
Fahad, please.
Because we may not have that single document that describe only health and safety part, but they will always include other ones. So that's why I'm asking if we need to extract only.
Yeah, you have to only like extract. For example, if you have a document which is showing the roles and responsibilities with respect to health and safety, and it is on all management level, that will be fine. If even it is other than the occupational health and safety policy, but it is confirming the roles and responsibility with respect to health and safety, then it will be okay.
Okay.
Yes, Fahad, please. You have waited a lot.
Actually, regarding the HSC policy,
yeah,
it's a piece of paper which signed by the top management or by the CEO in our organization, which is committed to provide a safe system of work in the place and etc. etc. But in the same time, that policy is linked to other procedures, which call it HSC plan,
Mhm.
and which showing all the parties or all the responsibility roles and responsibility of some peoples who's contributed in the EHS or the HSC. Did you mean by submit the evidence you need that piece of paper, I mean, which signed by the CEO example, or
Yeah,
you need that
yeah.
part, or you need that part which all people contribution is in the HSC?
No, no, for the
Can you share the
document,
details?
the document should be authentic, and the document should be relevant. The document should be acceptable. How that if someone from the managerial staff just uh, managed to create some documents and showing the roles and responsibilities generally is not enough for this purpose, because in the organization you know very well that the document which is coming from the top management with some authority is always acceptable. Other than that, other documents just showing the roles and responsibilities will not be considered in this.
That's mean in this question I have to submit it as an evidence the HSC policy of our company.
Yeah, absolutely. And secondly, what you can produce, like you have a health and safety department, you have a health and safety
Yes.
department, and the roles and responsibilities of health and safety department are organogram for that typical portion of the
Yes.
organization or department of the organization. That will be enough for this.
Okay, good.
Yeah. Okay.
Thank you.
Welcome. Okay, now 1.2, educate the health and safety policy to all key stakeholders in the organization. Now, it is discussing that who is key stakeholder. First, we should know that what is stakeholder. As stakeholder, we can also call them the interested parties who has some stake, who are involved, or maybe indirectly they can be affected. So all of these are stakeholder. So what you have to do, you have to actually communicate or share the health and safety policy information to all of them. So what you have to do, you should have a clear plan for that. Like you have developed an health and safety policy, you have organizational structure for occupational health and safety roles and responsibilities. No, you should have a health and safety plan there. The plan, like you can say, health and safety plan are simply a plan which can help you to communicate that information which is present in the policy to all the stakeholders. In this regard, you can produce toolbox talks, you can do inductions, you can do through meeting minutes, emails, training sessions, you can communicate your health and safety policy. All of you knew very well that in the induction, the first thing what we discuss with the new workers is about the health and safety policy. So you have to communicate that information in any form, like in the form of training sessions, meeting minutes, etc. Now moving forward, the third one is assess the existing health and safety systems, policies and procedures in the organization. So in this regard, what you have to do, that you just have to write there that how you are looking at your health and safety systems, your policies, procedures in the organization. So this assessment should be, you can say, a proper assessment, you can say a relevant assessment, and this assessment is an independent assessment of your management system, that how your management system is working, how your existing policies are working in your workplace. in your workplace, and everyone has to consider his workplace for this purpose, and then he will assess how his health and safety management systems in the organizations are working, how the policies of this his organizations is working. So you have to actually assess that, and in response to that, you have to discuss in response to this, that how your organization is performing, or how your organization is actually having the health and safety management system and policies. Now we have 1.4. Yes, Mahmood.
So, Mr. Asad, that's meaning that you need to check that this policy is being effective on the yearly basis.
No, actually it is effective. Or actually you are Mahmood, here you are just like a person who is just critically reviewing it, that in what stage, in what position your management system is, and how it is working, how the policies are working. So you have to just assess the current position of your health and safety management system and policies. Okay, Mahmood?
Actually, I didn't get the idea very well.
Okay, listen.
Still, I didn't get the idea very well. That's why I am still confused.
Okay, just listen. That you have an health and safety management system in your organization, and you have policies and procedures in the organization. Simply from different indicators, you can check that how your health and safety systems, policy and procedures are working. So you just have to check out your, first of all, you will see your health and safety management system. You will assess that what level of health and safety management system is established in your organization, whether it is on proper law, it is with implemented through good standards, what is the quality of your policy, whether your policy is relevant to workplace, whether the policy, what the policy is asking from you, or whatever the objectives your health and safety policy has, are the objectives are smart enough, like they are time bound, they are specific, measurable, reasonable. So you will check the effectiveness of that. And procedures like how you are performing different activities in your workplace. So how that procedures are working with respect to health and safety in your organization. So you just have to write the actual situation of these three things in your workplace. Is it fine, Mahmood?
Yes. Okay,
thank you. Yes, teacher.
Please, so when you refer, sometimes what we provide as evidence, you kind of like give another understanding. And I saw that 1.2 and 1.3 now, you haven't told us which type of evidence will be required there. Because when sometimes we go with what the evidence is, they will be able to know exactly what you want.
Teacher, in 1.2, teacher, I told you that you have, you can use the evidences like minutes of meeting, training sessions, inductions, toolbox talks you can use. But when you are assessing the existing health and safety system, policy and procedure, you don't have to produce any evidence, because as you know that if you are measuring, you are using some indicators. So mostly do remember, health and safety is a qualitative thing. Once you are just assessing it on its effectiveness, there will be no tangent evidences there that you can help them out. So in 1.3, you don't have any specific evidence to produce, because you are assessing that what is there. You just have to discuss there, you have to type there. And in 1.2, because it is involving different stakeholders, so you have to produce, like you are doing toolbar talks, so you are communicating the health and safety policy information there. You are performing induction trainings, you are performing training sessions, you can explain the health and safety policy there. Is it fine?
Yes, it's fine, because I'm asking because as per the structure of the notebook, of the workbook, is requiring evidence. So that's why I'm
yeah, no evidence required in this one. Okay, and do remember all of you, that if sometime it happens that you don't have any evidence, but you have explained the thing very well, it is not necessary to produce evidence all the time, but you have to be well mapped to that assessment criteria. And if sometime the evidence is must, then I will definitely ask from you that please produce evidence on this assessment criteria. Okay. Now moving forward to 1.4, we have evaluate the statutory and workplace health and safety requirements relating to input of products and services, the conversion processes, output of products and services, inadvertent, unwanted and unnecessary goods, materials and waste of all types, employees, contractors and other affected by the organization's activity. So here, what you have to do, you have to check for the statutory requirement. What statutory requirement? Like, you know that for everything there are some regulations. For example, you have regulations like KOSH, you have POR, you have LULR, and such type of regulations are there that are coming from some regulatory bodies, or they are coming from some statutory bodies. So in that regard, what you have to do, you have to evaluate in your workplace that if, for example, I'm just giving you example of for the equipment. It is saying products or services or equipment you are using there. So you should have a proper system there, like control of occupational health and safety hazards, cost there. You can use power, like the equipment you are using in the workplace. So in this, you have to let me know that what type of regulations you are using in the organization. So for this purpose, along with even we can consider the health and safety policy there, but even the statutory requirements, regulations, you have to provide that you are using this this regulation or this regulation. For example, if there is a lifting activities in the organization, then you should be using the lifting operations and lifting equipment regulations there in your workplace. So you have to let me know the regulations you are using in that workplace, in your workplace. Is it fine, please?
And please, can we also use our local regulations? Because, for instance, in Qatar, we have what we call the construction specification.
Huh?
That regulates these activities. Can we also use that one as evidence?
So I'm saying that what regulations you are using, you have to explain that. Like for example, you are using PPE regulation. You are using, simply you say that we have a reporting system with respect, because we have to report, like RIDOR is there, reporting of injuries, diseases and dangerous occurrences regulations. So there will be some regulatory requirements for PPE. You know, there is a personal protective equipment regulation, 1992 is there. So you have to wear PPE with respect to that. So there are different regulations. So everyone has, with the nature of his workplace, everyone has different regulation.
Yes, I'm aware of that. So that's what I'm asking. Does must it be international regulation or the local? Because in Qatar we have.
Okay.
So that's what I'm
Okay,
asking. Is it
normally,
applicable?
normally, you know, teacher, that mostly the regulations which are implemented are coming from international bodies. Like whenever you have some regulation, even mostly because these regulations are coming from the developed countries. So underdeveloped countries or third world countries are just putting them in their systems, but in that countries they are using their own regulations. So what you have to do, if I can't say that you only give me international or you only give me local, because there are some local regulations there. There are set of international regulations there. Whatever you are using in your workplace, you have to produce evidence of that.
Actually, Mr. Asad, as we are
Yeah.
following the SRA,
Okay.
this we can take the regulation from that one.
Yeah, you can say, if Mahmoud, you are using the regulation, like your country is strong enough and they have their own regulations on the basis of International Labour Organization, on the Convention of International Labour Organization, or on the basis of international standards, and you have your own standard or regulations in your country, then you have to write that regulations.
Yes, that's what I mean, because we have our own here in UAE, and we have our own.
When you have your own, you should use that. Whatever you are using in your workplace, I only need evidence of that. I'm not pushing you that you have local regulations, you have international regulation. No, you just have to confirm me or satisfy me on this assessment criteria that you are using some regulations for this purpose.
Okay.
Yeah, yes, teacher.
And here also, do we have to provide the evidence?
Yeah, you have to provide evidence.
Okay.
Okay, now moving forward, we have the last one, 1.5, identify those external to the organization who may be affected by its activities. It is just simple that in the organization, in the workplace, what is the main, you can say, source of identification? Always when you are performing a risk assessment, so risk assessment is the basic source in which you can identify the hazards, you can identify the people. So it is asking that identify those external to the organization who may be affected, that who are the persons other than the organization's worker or employee can be affected. So for that purpose, you have to perform some risk assessments, or it may be defined in your health and safety policy that these are the special cases, or these are the special things for that. For them, you have to make some special arrangements. So like trespassers are there, like general public is there. So but you can't write general public. Like if you are working alongside, yeah, you can say away from the city, just you are having a camp there and you're working there. So there is no general public, but there is a chance of trespasser who is not involved in that activity, but doing some other activity and can be affected by that job or that activity. So what you have to say, that you have to identify those external to the organization which are external to your organizations. Okay, and for that purpose you just have to evidence that we have performed risk assessment, and these are the person who can be affected, these are the internal internal employees, and these are the external employees.
So it might be the visitors or stakeholders.
Yeah, absolutely. Visitors, these are external, or sometimes you know, the supplier are external because they are not part of that activity. They are just there to supply. They are just there to supply the equipment to you to perform in that area. Is it fine, Mahmoud? Everyone?
Yes, yes.
Hello, Mr. Asad.
Yeah, teachers, yes.
I found that in this session you are not actually giving us what documents are required for the evidences. I don't know what is happening.
No,
So
just listen. Just listen. When it comes to health and safety policy, teacher, you just have to map your all the assessment criteria when it comes to this course, this unit. You only have to map your each and everything with respect to your health and safety policy. And secondly, what can add in your health and safety policy? So here only we have to manage or map up the things around the health and safety policy, or whatever we are getting from the health and safety policy. So we can't produce too much evidences for it. Like simply for a 1.5, identify those external to the organization who may be affected by its activities. There is a simple thing, that what is the tool you are using for identifying anything in your organization. So it is simply the risk assessment. Other than risk assessment, you don't have any specific or any sufficient tool there to identify the people. So there are some less evidences, and units to unit it normally varies. So in this, because it is health and safety policy, and there are 3 sections in the health and safety policy. First one, your intent, what do you want to do, we have discussed in the one. And then what are the organization section, and then we have the third one, we have arrangement sections, like what we will do for what we have planned in the starting, what we have set the objectives. So for this purpose you have to explain things rather than just focusing on evidences. So unit to unit it will vary. So I can't give you that much evidence. Like in 1.3 we don't have to produce any evidence, because we have to assess our own workplace. So in assessing that workplace, you just have to explain that your management system is good or bad, why you are thinking that it is good or bad, how your policy is performing well, is your policy sufficient, is your policy suitable. So for sufficiency and suitability, you can't produce any evidence other than your explanation. Okay. Okay. Now moving forward, for be able to develop the health and safety policy. Now see here, look here, that in this learning outcome, it is just focusing on the management role. As all of you knew very well, that development of health and safety policy is a responsibility of top management. So for that purpose, the top management has to perform. Okay. Now the first one is 2.1, identify deficiencies in the current health and safety policy. For this regard, what you can say, first thing, you have to identify deficiencies in the current health and safety policy, like this is not working, this is not working, this is not working, it is not more relevant to it. And what type of evidence you use? You only say that this was our health and safety policy, and after identifying deficiencies, we have amended this health and safety policy. So the evidence will be the older version of health and safety policy and the newer version of health and safety policy. Is it fine?
So it's a review when accident happen, or when
No. No. It is asking that when it comes to developing a health and safety policy, it is not just an accident or incident happened and you decided to develop the health and safety policy. Actually, it is just considering all the factors which are deficient, which can create deficiencies for health and safety management system. Then as a whole, we will consider them, and then we will decide that what type of arrangements we have to do for removing that deficiencies.
That's
Yes,
meaning the updated health and safety.
yeah,
policy?
absolutely. Like Mahmood, you have seen a deficiency in your health and safety policy. You came to know that it is not sufficient for all the employees. It is just focusing on just 2 or 3 departments of the organization and not working for the others. You have to modify that because you have identified the deficiency. So you will identify the deficiencies in the current health and safety policy. So you will explain in answer to this, and you will modify your current health and safety policy. So what is the evidence that the old version of health and safety policy was having some deficiencies? Now you have modified the old health and safety policy. Now the newer version is sufficient for your management system. Yeah, teacher.
So suitability in your workplace is working or not working?
Yeah, simply for identifying the deficiencies, you don't go for the, you can say, basic grassroots level, what is accident, incident. You don't go directly there. What you have to check, the suitability and sufficiency of the health and safety policy. It will clear you that there is deficiency or it is working properly. Yes, teacher?
Yeah. What if in the course of this study we find that deficiency, but we are not able to get the management signature as to the required improved health and safety policy, which we may propose, because by every standard I'm quite far away down the management level, which I may have little influence on the health and safety policy. So how do we get the improved health and safety to submit as evidence? Because for instance, now I may do the assessment, find some deficiency, make improvement plan, but it takes a lot.
Teacher, just like I've got it. So do remember that for this qualification, you can use the evidences from the last 6 months. In this regard, like if like you can say that 1 month before we have identified some deficiencies in our health and safety policy, and we took 15 days, 20 days to remove that deficiencies. So this is the older version of the health and safety policy, and this is the updated version of health and safety policy. Because I can understand this, that in a day or 2 day or in a week, you can't update a health and safety policy. But here we are just discussing that in the development of health and safety policy, you should know that what you have to do, how to identify the deficiencies and how to remove that deficiencies. Like you are not in the top position of the organization, but you are somewhere in the part of management. So in that regard, you have to just explain what your management did with the old health and safety policy and with the new one. Yes, teacher, you are mute. I can't hear you. Unmute yourself. Yes.
All right, I said I was just talking that in that case, so we may not get the sign because what we have now may be signed, but because I believe evidence should have the signature of the senior management, yes?
Yeah, it's fine. It's fine. It's fine.
Or can we have without the senior management signature?
Yeah.
The evidence.
Yeah, evidence. You don't put like if there is available signer is the part of that, then you can produce that. And if there is no sign required or something like electronic document, but it shows the authenticity, then it's fine.
Okay.
Yeah. Everything is clear about this point, please? Fahd, Mahmood, Asdi, and
Yes,
other
yes.
guys, please.
Yes.
Okay, fine. Okay, now moving forward to 2.2, identify resource constraints that could affect proposal for change. So in your organization, you have to describe that what are the resource constraints that which is restricting use for proposal for change. Like, you know, that sometime what happened, you have identified the deficiencies, but you can't change them easily because there are some constraints there. So you have to explain the barriers in your organization for modifying the health and safety policy, or you have to identify that what are the barriers or restrictions you are facing for the for any change in the health and safety policy. Okay, so you don't have to provide any evidence because you don't produce any evidence. You just have to describe the barriers what you are facing in your organization. Okay. Hello.
Yes, Mr. Asad. Okay.
Okay.
Yeah, we
Okay.
got that one right.
Okay, fine. Okay, now in 2.3, it is saying provide opportunities for key stakeholders to review the revised new policy. So it is just like that you have identified some deficiencies and you have removed that deficiencies, and now you are just going to implement the new health and safety policy. So he's asking that, are you providing the opportunities for the stakeholders that what you have, what the changes you have made are actually will be worked for all the stakeholders or not, are just getting their opinion or some suggestion. So there is an opportunity that what is the easy thing you can say that you remove the deficiencies, you modify the health and safety policy, then you should communicate that changes to your all the stakeholders with the help of meetings, communication meetings, their committee meetings, and through emails. And after that, after their review, then you have to go for the implementation of that health and safety policy. So what here you have to explain that whenever you have a chance of modification of health and safety policy, how you are communicating this, are discussing, are getting suggestion on modify health and safety policy. So what you are doing, so in the past in your organization you have an older version of health and safety policy and you have modified that. After the modification, what your organization did to get the review or suggestions from the stakeholders. So you have to produce some type of evidence confirming that you have also involved in the review process all the stakeholders. Is it fine?
Yeah.
Okay.
So which type of evidence do we provide here?
Yeah. Just
Because our policy is always displayed on the
no
website.
policy display is basically communicating the policy. Policy display is something, teacher, communicating the health and safety policy that you have decided that you did okay, and you have put it the health and safety policy there on the board or on the notice board or anywhere you put it there, and it is just like that you have decided. Before communicating to all the workers officially, before that you have to take on board these stakeholders and communicate them, these are the changes we have made. Just review that, suggest that how you are thinking about these changes. Once they are showing, most of them are showing they are just going with you that what you have done is okay, fine for them, then you will communicate health and safety policy.
So we can consider the review meeting is okay.
Yeah. If you did a meeting, like you have made the changes before putting it properly on the manual of your organization, or just putting on the notice board, just before communicating the health and safety policy, you have to take all the stakeholders on board. Is it fine?
Okay, Mr. Asad, okay.
Okay. Now we have revised the health and safety policy to remedy deficiencies. There will be no explanation at all. You just have to provide evidence. What type of evidence you have to provide? That after the review from stakeholders, you have revised the health and safety policy. So in this case, you have to produce the older and newer version of health and safety policy as an evidence. Okay. Is it fine for everyone?
Okay.
Quick question. Please.
Yeah, teacher. Yeah.
Yes, because we are only talking about deficiency. So what if after the review you find out that there is no deficiency? What do you do?
Like if you are not having any deficiency, like
Yes.
what you will say that even in the past you will have had a deficiency in the past, so you will explain that. But do remember, teacher, that health and safety process is a continuous improvement process. So you can't say that the health and safety policy is not having any deficiency. Even you are working too hard, but whenever you are going forward, there is a chance of certain improvement. If you are not having main deficiencies, if you are not having 10, 4, 3 deficiencies, you may have a single deficiency there. So you can discuss that.
All right.
Okay.
I get that point because our current policy was already reviewed. I think.
Yeah,
Like,
absolutely. Like just do remember the health and safety policy you have right now with you. In the past, maybe before 1 year or 2 years, it had a deficiency there. And
okay, so we can
always,
mention that one 2
sorry?
years back.
Yeah, even
Can
1
we
year
mention
back, if you don't have
Okay.
current deficiencies, you can explain in the past that on this date we have a newer version of health and safety policy, and you know that in where you have a proper documentation system, there is clearly something mentioned like the version V1, V2,
Yeah, revision
V3.
date, yes.
It is just confirming that you are just making some changes in the older version and you are getting the new one.
Yes, sure.
Okay. Now moving forward, 2.5, formulate the strategy for promoting commitment to the health and safety policy by all those in the organization. So it is just showing that how you can make sure that everyone in the organization is committed for the changes you have made for this health and safety policy. For this purpose, like simply it is asking about that you are promoting commitment. In this regard, you have to perform TBT, you have to perform the training sessions, inductions, for awareness to this, for communication of this health and safety policy. So the strategy will be clear that you will perform activities by the virtue of that you can communicate this health and safety policy clearly to all the person or all the people present in the organization. Okay.
Okay.
Now moving forward. Okay, now we have 2.6, advocate the adoption of the new improved health and safety policy. So do remember that whenever there is a change, whether it's good or whether it's bad, it is not easy to accept that. Okay, in this case, for adoption of that new improved health and safety policy, what you have to do the same. How you can improve, how you can communicate this new improved health and safety policy. For this purpose, you will perform safety committee meetings, you will perform TBTs, you will communicate it through meetings, you will communicate it through a notice board or different arrangements. You will perform some management review meetings, like for example, you have adopted this one and some of the guys are still not getting the idea of the improved health and safety policy. So easy thing is that just sit there and have a review meeting there. And in that review meeting, you will discuss that before we were doing this and we are facing such problems. Now, with the adoption of new health and safety policy by the organization, now we are performing well. Now we are performing well in health and safety. So these are actually the means of communication, are means you will use that will improve the adoption of new or improved health and safety policy. Is it fine?
Okay.
Okay. Now we have learning outcome. is be able to implement the health and safety policy. Now you have developed the health and safety policy. It is important that you can implement the health and safety policy, that you can be able to implement the health and safety policy in your organization. 3.1 is asking specify the strategy for implementation of the health and safety policy to include providing support and assistance during the implementation process, planning effective action in case problems arise during implementation, provide adequate opportunities for feedback, responding appropriately to the feedback, planning the implementation process to ensure minimum disruption. So here, what you have to provide, like the every point it is discussing is just discussing itself. Like, for example, providing support and assistance during the implementation process. So you have to explain here that you are going to implement a health and safety policy, the newer version. So how, being whatever your place, whether you are a safety manager, safety advisor, you have to explain here that how you will support and assist in the implementation process. And then planning effective action in case problem. You know, as I told you before, that whenever you have to implement the new thing, a change thing, there should be some problem. So you should have a plan for tackling that problems. So you should have a clear plan for that what you have to, what type of actions you have to take if some type of problems arise there. Then what type of opportunities you are providing to the workers for the feedback, what is your plan for the feedback, and you should, how you will ensure that the minimum disruption happen in the phase of implementing the revised or newer version of health and safety policy. All these things can be controlled by TBTs, training sessions, inductions, management review meetings, committee meetings. For example, in simply what I will do, I'm just discussing a case study here. For implementation of health and safety policy, the best thing, first of all, is that I will decide to I will go for the training sessions for different levels. Why I am not conducting, or why I am not interested to provide a same training to all the workers or all the employees? Because with respect to health and safety policy, we and due to the organizational structure, we have to perform different jobs on different levels of the organization structure. So I will perform a simple training need assessment, and then I will decide that this type of this portion of policy is specifically for the top management, this is for the middle manager, this is for the general employees, and then step by step I will train them all. So training sessions for implementation of this health and safety policy, or even a simple health and safety policy, will really work there. And secondly, because I have implemented this health and safety policy through trainings, so the best thing will be that I should have a plan there, that if someone is coming, the new or fresh guys coming in the organization, I should have a proper induction training there. And in that training, my first priority will be that I should clearly communicate the health and safety policy to him, because it will definitely help to help in the support assistance of the implementation of health and safety. For this purpose, you can use the TBT, training session, inductions, management review meetings, and committee meetings as evidences. Is it clear for everyone?
Clear?
Yeah.
Okay. Okay, now, gentlemen, it is saying that ensure quality management requirements are applied to all health and safety documentation. It is just saying that you know that there are many documents you have in your organization with respect to health and safety. You have different recorded documents, evidences, or many things are there. So in this, it is saying that the documentation process or the document controlling for health and safety should be on good quality standards. So it is just discussing about. In this regard, you don't explain that we have a quality of this document. You only have to provide some of the procedures, that what type of procedure in your organization do you have for controlling the health and safety documents. So you have to produce the evidence like document control procedure, control document register is there, evidence of document controls with health and safety policy. So you have to produce evidences for this. Clear?
Clear?
Okay.
That mean the document register is enough for as an evidence.
Yeah, absolutely. If you have a document register there, just it will confirm definitely that every document is in record and is in a well recorded form that I can or whenever it's needed, so the concerned person can easily access that document.
Okay.
Okay. Now moving forward, we have the learning outcome, fifth one, the learning. Now the steps required to develop and implement the health and safety policy. Like you have seen that in the earlier part of this unit, we were discussing about the deficiencies in the health and safety policy. We are discussing that what is in the health and safety policy, or just how we are communicating health and safety policy and implementing that health and safety policy, and also the structure, what are the legal requirements there. Now it is saying that how we can develop and implement health and safety policy. There should be some proper you can say proper steps involved there. So do remember, because in it we have everything with respect to explain, describe, explain, describe. So it is just asking questions and answers. You don't have to produce any evidence for this. Just okay. Now moving forward, it is saying that number one, explain. Now what we are discussing, that we are new, or you can say we are new to develop a system. So because all of you know that health and safety policy is the foundation stone of any health and safety management system. So in 4.1, the criteria is explain the nature and the role of health and safety policy within the organization. So what you have to do, you have to explain that what type of health and safety policy you are having in your organization, what is the nature and role of health and safety policy within your organization, like what elements make up of the health and safety policy, what roles that does it plays within the organization, demonstration of management commitment, defined responsibilities, etc. Like just you have to explain your health and safety policy, that what is its nature and what is the role of health and safety policy in your organization. Is it fine?
Okay.
Okay, then. Yes, teacher.
Yeah, I just want to ask a quick question before I leave. Though I'm going ahead of myself.
Yeah.
Because in the first one, the first assessment unit 1, we also have this last part, be able to maintain records and professional development. We didn't deal with that, and it's still appearing here. So I want to find out, are we going to do that at the end of all this?
Yeah, the idea is there, teacher, that for development of CPD, we will discuss in the last, but today I will touch this topic too. So if you are leaving, even you are leaving that in the recording, you can check that in the last portion, I will little discuss this one.
Okay.
Okay, fine. Now we have 4.2, explain the input conversion output model of organization system. So like what kind of input conversation and output system you have in your organization? It is just simply you can say that what type of model you are having in your organization, like how you are inputting the information, the conversation, and converting them to the output. You have an organizational model. You will have a plan for that in your organization, that how you are performing, like how you are conducting the activities in your organization. You should have a model there for this purpose. Is it fine? Hello? Hello?
Hello, with you, Mr. Asad.
Yes, your voice is clear.
Okay, fine. Now 4.3 is there. Mahmoud, are you there? And other guys also then
I am there. I am just questioning that in the
Yeah.
explanation of the converting. You need to convert this information of the health and safety policy with the people.
Yeah, absolutely.
This
Absolutely.
module, so this
Yeah.
module can be a form that we can tell them that we are using some kind of forms for converting this.
Yeah, what you will say, that simply you can say that you will have some form or way of collecting the information as an input, and then you are using that feedbacks, that suggestions, and then putting some model there. Like on each organizational level, you are getting the inputs from the people and then converting them and giving the output a good model for the organization for the development of health and safety policy.
Okay.
Now we have
So any guide support for that as an example, as you said?
I'm just saying that it will be just like that. For example, you know that whenever we have to develop health and safety policy, or we have to change health and safety policy, or we have to implement health and safety policy, before the development, you need some inputs or feedbacks from the stakeholders, from the top management and the people working there, and then using that suggestions, feedback, with accordance to your nature and role of your organization.
You're gathering data from workplace.
Yeah.
You're gathering all that.
Basically, you are getting the information or data or feedback information from everyone and converting them and arranging that data information according to your organization for the development of health and safety policy or for the development of organizational systems. Like for sometimes you can't develop health and safety policy without the input of general employee, because he is the person who is performing there. So his suggestion will be important. Okay.
So Mr. Asad, can you support this information by example? So as a guide for us, what I can do in this situation, step by step, no need to lose. Yeah.
Okay. like first what you will say that you have a clear system. Like first you will say that
Yes.
we perform different surveys, we will perform the feedback forms, we will take feedbacks from the workers, we will take suggestions from the stakeholders, and then we will use all that information, because they can't develop a health and safety policy. So it is a part of management system. They will purify that data, they will filter that data according to the organization, and then give an output, and that output will definitely work for the organizational systems.
Oh, you full system.
Yeah, full system.
Yeah.
Okay. Okay, now 4.3, describe how to recite the organization's current health and safety procedure. Now, what the teacher was actually saying at that time, and even Ali has discussed there. So now it is discussing that how you can research that what is your organization current health and safety procedures are working. You were discussing the methods for the health and safety policy. So it was not fit there in the health and safety policy, because you in the health and safety policy portion, you only have to check the sufficiency and suitability of that. But when it comes to safety procedure, there are audits, there are inspection systems, there are examination systems, there are management review meetings. So that are the methods you use to research that how your health and safety procedures are working. Okay.
Okay.
Okay, then we have explain how individual and group motivation will be achieved. It is simply you have to explain that why motivation is required, are needed, important, and what type of motivation do you have in your organization. Like I just simply say that first you have to explain the why we required motivation, and you know that when it comes to motivation, like in your organization, you have seen sometime organization is giving 10,000 hours without injury, 1 lakh hours without injury, and employee of the month, safe the employee perform well. There are some bonuses, there are some lunch, there are some meetings, there are some lunch, there are some appraisal there. So that will be that will help out to just motivate the workers. So in your organization, what are the methods your management is using to keep the people motivated in the workplace with respect to health and safety? You have to explain here. Is it fine?
So that means this is only explanation, nothing else.
Sorry.
This is only explaining, nothing else, not providing any evidence, nothing, only explaining.
No. Just you have to explain. In this, Mahmoud, you have to explain in this section. You don't have to produce any heavy evidence, because you can't show me like you have given someone appraisal, you have given someone 5,000 of real, 1,000 or 500. So you can't say, you just have to explain that how we are motivating in the organization. Now we have 4.5, the last one. Explain external factors influencing health and safety, examples, statutory health and safety requirements, and industry best practice. So just listen, gentlemen, that in this case, what you have to actually explain. You have to explain the factors which are affecting your health and safety externally. Like, for example, first thing is that by law, you can't do anything, because as you know, whatever the circumstances, the minimum requirement is to obey the law. Without obeying the law, you even can't work there. So the statutory requirements are there, and then when it comes to the quality of work, you have to check out, you have to do the benchmarking, like what the same type of organizations like you are working, are doing in performing their operations. So there will be another factor, like someone, you have an contract in your hand, and simply you bid for that, and the client say to you that other organization has they are just obeying, working according to this standard. They are certified from ISO, they are certified for 14001, they are certified for QMS, they are certified for environment, health and safety, and they are certified for different operations for in the construction, like from ACI, from ASTM. So there is another factor of industry best practices. So what type of factors, external factors your organization is facing, you have to just discuss that. Is it fine, gentlemen?
It's okay.
Okay. And secondly, I am not going to discuss this CPD topic, because I just want to keep it in a separate class, because CPD, I don't want to just confuse you people, because you just complete your units. So don't look at the CPD portion.
Is it continuing professional development?
Yeah, that is it is. Okay. Is it fine for everyone? Ali, it's fine. Teacher Mahmoud. Is there any question, please? Adil, Fahad, you were too quiet today.
Fine.
I think Fahad was busy somewhere and just put me on auto mode.
No, I am not busy. I am not actually. I was working for the last unit, and almost 19